Well, thank you, Dr. Tanya Paynter, for jumping on a call with us so quickly on such short notice. For those of you who haven't listened to episode 6 or seen some of the TikTok videos, we've been getting a lot of questions related to histamines, B12, and the MTHFR gene mutation. So we wanted to take a little bit of time to go through your questions and get them answered. So let's jump right into it. First, can you give a high-level explanation of what the MTHFR gene mutation is for those who don't know?
Sure. So this is actually, it's become fairly well known actually over the last probably 5 to 10 years. And essentially the MTHFR gene, it's methyl tetrahydrofolate reductase, and it is an enzyme or a gene that's responsible for the enzyme that basically helps with a billion different things in the cell. And when we don't have this gene working properly, then we have a problem methylating different hormones, neurotransmitters, things that are essential in order to break down or make different things in our body. And so when this gene is mutated, then essentially we're just not able to produce or break down things properly because it needs that methylation to happen, which we can't do if we don't have the MTHFR working properly. Hopefully that's clear.
Yeah, I only first learned about this gene mutation in graduate school when we learned about the homocysteine methylfolate trap.
Yeah.
I took vitamins and minerals, and so this was in the lesson about folate and B12, which when everyone was freaking out about it, I was like, oh my gosh, like I learned this in school. But what I didn't learn in school, which is why I am just so appreciative of you, was like what to do with once you have this. And so I actually found out this year that I have the MTHFR gene mutation. And I was like, oh, you supplement with B12. And, kind of just ended there. My notes from school said methylcobalamin. And I was like, great, done. And so when our listeners were freaking out the histamine and they were like, what do we do? I was like, I have no idea, because that's the extent of what I learned in school. So for those who also have the MTHFR gene and know that B12 is important and have histamine issues, is there like a correlation between the two? Is it common to see people who have the gene mutation also having histamine issues? And is there potentially a reason for that?
So I actually don't know the answer to that first part of your question, if there is a correlation between people with MTHFR and higher problems with histamine. I don't know if they've done a study on that or if there is. I tend to see it all the time, regardless of MTHFR status. But then again, I tend to see a lot of people that have chronic issues. So this is usually a piece of that, right? So when it comes to, here's the thing. We're becoming much more aware of how our genes are functioning and affecting our health and how we feel and how our body is acting. And along with MTHFR, another very common gene mutation that we see is the MAO gene. And so this is a gene that is very responsible for breaking down neurotransmitters, hormones, and histamine. It's one of the major ways we get rid of histamine. And so I think part of the problem why so many people with MTHFR mutations that are aware of it and are taking methylfolate, methylcobalamin, because they know that that's the form that they should be taking. And they're absolutely right. Like that is the form they should be taking. But what we end up seeing then is nobody teaches them how to take it so that they're not over methylating themselves. So we have to have methylfolate and methyl B12 to break down histamine. But the problem comes when we have too much, and then we overwhelm, like we attach all the methyl to the histamine, but then now suddenly we don't have a big enough pipe for the methyl histamine to go down, right? So then the methyl histamine backs up because there's this traffic jam because the MAO gene is maybe not working the way that it's supposed to and breaking it down as quickly. And so then we start seeing this extra histamine reaction that's happening. And so that's where this overmethylation, under breakdown of the methyl histamine happening. And it can be, again, from a gene mutation separate from the MTHFR. But if they haven't been tested, for all of those genes, then they're not going to know that that's an issue for them. So I'm going to just preemptively talk about what I said about how to take it properly, because I know that's going to be a question. Someone's like, what's that mean? So when it comes to like when you first start, you're just learning that you have this mutation, that this is an important thing. You should be on these methyl vitamins. You're coming from a deficit, like you're coming from, you're deficient in these methyl Bs. So you take it and you feel amazing and it's wonderful, but then you can't just take it forever and be done. Like that's just not the way that our body works, because at some point you're going to become replete, meaning that you've got as much as you need and you're back to kind of normal status, but you keep taking these elevated numbers, these elevated supplements. And now suddenly you started down here, you've come up here, and now you're coming over here. And now we're dealing with a whole set of other problems because you've got too much methyl stuff going on. So when we're dealing with a genetic mutation and we're coming from a point of deficiency, we need to take high doses to get up to 100%. And then we need to stop. And then we need to be paying attention to how our body is functioning. And when you start paying attention to the symptoms of undermethylation and overmethylation, you will start to learn when you should be taking them and when you shouldn't. So things that use up a lot of methylation, where a woman is at in her cycle based on how she has to break down her hormones. High stress will cause a lot of methylation. If you have histamine issues and it's allergy season, you will need to be more methylated. And then on the periods of time where you're not experiencing those things, life's going good, you're not really having any stress, it's not any like hormonal issues going on, then, and it's like the middle of winter and you have no allergies, you probably don't really need to be taking a whole lot. And so we call it pulse dosing, where you take high amounts for a short period of time and then stop it, or take lower amounts depending on what your body needs. And so that is very, very individual. There is no one size fits all pulsing. Well, does that mean I should take it once a week, twice a week, 4 times a week? Sure. It just depends on your body, right? So that's what I mean by they need to be taught how to properly take it so they don't end up over methylating, which then causes problems with things like methylhistamine and some of these other issues.
That's really interesting. It makes so much sense though how you can overmethylate. So is there, like, I guess you were saying like the time frames that you need more and less. What are the symptoms that like either you're like deficient in it and you need more, or that you've taken too much?
That's a great question. So one of the very, very basic guidelines that I use to teach my patients of when they need to back down, when you first start taking it, you're usually coming from a place of depression, lethargy, like low energy, you just kind of feel bleh. And then you take it and suddenly your spunk is back and your brain is working better and you have more energy and things are great. And then very slowly, that you might not realize it, you start getting a little more anxious, and then you start getting really snappy and you start being like just kind of that crabby person. Now you're starting to get overmethylated. So a good way of judging it is if you want to curl up in a corner and cry yourself to sleep, like that means you're undermethylated and you need more. And if everybody is running away from you because you're just not being a very nice person and you're super short-tempered, then that means you're overmethylated and you need to back off. So that's kind of a good general rule of thumb. And then the person can really pay attention. Oh, sorry about that. Can really pay attention to how the other symptoms that come along with those mood swings. And then they can start to feel, oh yeah, well, I feel these symptoms like my insomnia or my joint pain that's getting worse than when I feel depressed, versus I feel like some heart palpitations, or I feel like I'm over caffeinated and all jittery and stuff. And then they know, okay, well now I've got too much on board, right? It's a learning process.
Yeah. And I can only imagine how trial and error that is at the beginning, then how satisfying that must be once you figure it out and you really are in tune with your body. That's also probably really empowering for your clients who have been struggling and dealing with this for so long, to finally be like, I understand what's happening in my body and how to support it. And a lot of the listeners who are commenting on the TikTok made a lot of comments about energy specifically. And so they've definitely seen that correlation between their B vitamins and histamine issues. But one thing that a lot of listeners were asking on that same vein is, what exactly does it mean when you say like it creates that superhistamine? Like how does that methyl group from the methyl B12 attach to a histamine to create this superhistamine that can cause issues and maybe, like you said, those indicators that I'm way over methylated?
Yeah. So part of the process, part of the breakdown process, there's several different ways that that histamine can be broken down in the body. One of them is the DAO pathway. One of them is the NAT pathway. But the one that we're really talking about, that's kind of the major pathway, is this methylhistamine piece, or the and the MAO pathway. And so there is an enzyme called histamine methyltransferase that basically transfers, I mean, it does what it says. It transfers a methyl group to histamine to make the methylhistamine, which then becomes much more inflammatory and reactive than just regular histamine. And then methylhistamine then is broken down via this monoamine oxidase enzyme and then some cofactors into histamine aldehyde, which then aldehyde dehydrogenase is an enzyme that breaks it down into, and you're able to excrete it. So it's that transfer of that methyl group from the B12 or the folate to the histamine that forms the methylhistamine.
Got it.
So
Science.
when people,
oh my nerdy God. Science so terms, fun. I know, right? The biochemistry.
So interesting. I'm taking all the notes right now. So when people have this gene then, and it's like, is this why people continually like develop allergies as they get older? Because it's harder and harder for people to break down the histamine. And like, I know you mentioned this kind of two-parter in a previous video about the unclogging process. Would something like that help?
Yes. So we can see it's multifactorial, right? As we get older, we don't heal as fast. We do end up becoming more nutrient depleted in things. Other imbalances contribute to it. So there's a whole host of reasons why as we get older, we're just not able to kind of keep up. And so as a result, yes, we end up seeing that histamine will back up. Maybe our immune system is overactive in general because maybe we are eating foods that our body is sensitive to and we're having an overactive immune system. Maybe we have developed an autoimmune disease that's making our immune system more reactive. So there's a lot of different reasons why. And then as we become more hyperactive or hyperreactive to our environment, then we end up seeing those allergies and things happening. And then of course, there's the whole other topic of our gut integrity and how that plays a role in our immune system. And so as we get inflammation and gut dysbiosis happening in our GI tract, that leads to all kinds of different issues. So there's just a lot of stuff that can cause people to have more allergies as they get older. What was your second piece of your question that I don't feel like I answered?
Does the unclogging process help with this?
So it can for sure help. So the unclogging process, just for anyone who might not have seen the other video, very quickly, I kind of mentioned the the histamine methyltransferase to the MAOA, or the MAO to the aldehyde dehydrogenase. We work backwards, right? And we help to support the nutrients that are needed at each step, starting at the last step and moving forward. So we essentially unclog that drain. And the last thing that we reintroduce is the methyl B12 or the methyl folate, so that we're not trapping that methylhistamine. And that can be helpful. Like usually I'll have people do that, like people that have spring allergies, I have them start that process, that protocol in like now, February, because it takes about 8 weeks. And so that way they're ready to go by April or May when allergy season starts to kind of ramp up. And then they are able to tolerate a lot more exposure because their bathtub isn't overflowing, as I call it. So they have more ability to handle, an increase in histamine without having the horrible symptoms. I do it with my husband, and every February he's like, okay, what do I have to start on again? What am I supposed to do so that I feel better? And his allergies have been much more manageable over the last few years since he started doing it. And he's noticed a difference, so he makes a point of doing it. So it's just kind of a maintenance thing that you can do every year.
Yeah, a lot of our listeners were just so interested in what they should be doing, what they should be taking, what order they should be taking them in. And as Melissa said, there's just not enough information out there, not enough people who specialize in, I mean, it's crazy how your program is around migraines, but you're such an expert on all of these different areas because they all impact migraines. And I'm sure so many different areas. And right now we've just captured the attention of this allergy cohort. But I was curious, like, if our listeners could see right now, it's just a full page of what supplement should I take? What brand should I take? Should I do an injection, or should I do a tablet or a dropper? So I think that in your last video, when you talked about that unclogging process, I can't remember if it's the one you sent us or the YouTube you sent us. I've just been like digesting your content so much in the last 24 hours.
Too much information, too much Dr. P over here.
I know. I'm like, I can't keep it straight, but whatever it was amazing. And I'm curious if you could share with our listeners a little bit about, specifically for listeners who have the MTHFR and histamine, what this unclogging process would look like in terms of supplementation.
Yes. So step one is working on the histamine aldehyde piece, which essentially like your body makes the enzyme it needs. So you just need some B1. So making sure that you've got B1 thiamine on board. And so that's kind of the first step to start on for a couple of weeks. I'm not going to get into dosing. Dosing is an individual thing. So I'm going to refer anybody listening to their doctor for the dosing part, but B1 is what you want to use. Then for the MAOA or the MAO piece is magnesium, B6, and vitamin C. And so those are the cofactors needed. But then we have the piece of the MAOA, or I keep saying MAOA because that's a specific part, the MAO gene that plays a role in the actual breakdown of the methylhistamine. And so I had referred to a book called Dirty Genes by Dr. Ben Lynch. He was one of my teachers in medical school on these topics in MTHFR. He's amazing. Like you think I have some good knowledge, like he blows me out of the water. So he wrote this book, super easy to understand. And then three of the genes that he goes over in that book is DAO, which is important for histamine, MAO, which obviously we're talking about, and then MTHFR. And then there's a handful of other really important genes that he also covers. And he breaks it down to what you should be eating, what kinds of lifestyle things you should do, and supplements you should be on to help support that MAO gene to make it work optimally. And he calls it cleaning up the gene, right? So I would very highly recommend to anybody who is interested in this and wants to look at it closer to get some resources from him. MTHFR.net, I think, is his website. And by the way, I have no affiliation with him. I just really, really respect him, and he's very knowledgeable. So anyway, so that's his book. So that's something that, that's a very important piece, is to make sure that that gene is functioning properly. And then the last step would be the methyl B12 and folate. And those are the three phases. And then once you hit, I usually suggest staying on each phase for 2 to 3 weeks, depending on the person. If it's severe allergies, I'll say 4 weeks for each step. So this could be like a 12-week process, just to make sure that things are up and where they need to be. And then they stay on all of that kind of through allergy season. And then they can kind of go into maintenance dose where you get just a good multi-B vitamin. And there you go.
And sorry, Melissa, and when they're doing the other steps, should they be taking like an adenosylcobalamin or hydroxycobalamin, or like totally off B12 completely?
So I'm not going to say that someone with an MTHFR mutation needs to be totally off B12. And again, in one of the like 14 videos that we've done over the last 24 hours, yeah, I mentioned something about, it might not be a matter of stopping the methyl B12, because if you feel horrible off of it, you shouldn't be stopping it. But instead of taking 5,000 micrograms, you might only need 800 micrograms. So it might be a matter of just significantly lowering the dose. So again, that goes into dosing. That's going to be something to refer back to their doctor about, but it doesn't mean that you have to stop the methyl Bs. It just means that you need to modify how much you're taking to make sure you're just not over methylating. So methyl B is still the preferred way, because that way your body doesn't have to, like, hydroxycobalamin is the next best thing, but it is a step away, and your body has to make the methylcobalamin from the hydroxycobalamin. And again, there comes in that methylation piece. So, and that obviously is something hard for someone with MTHFR to do. So that being said, a lot of times in order to support the B12, just that the body needs in general, but also support the methylation, a combination of methyl B and hydroxycobalamin or adenosylcobalamin, or all three of them, can be very helpful as well to make sure that they're replete in their nutrients, but not over methylating. And that is another option to kind of consider. Yeah.
Yeah, no, I think that's really helpful. And I'm not sure, because we also got a lot of questions of like what brands have the B vitamins without methyl, and like if you could give some brand suggestions that they can then bring to their doctor, because we still want them under the advice of the doctor, but if they have trouble locating them.
So again, going back to Dr. Ben Lynch, he actually has a brand called Seeking Health. And because he is so involved in the MTHFR mutation world, like he has literally created everything you can think of under the sun relating to methyl Bs. He's got one called B- that has everything in there except for methylation stuff, knowing that there are some people that need to not have methyl Bs. So B- is one from Seeking Health that I use all the time because it's a really good quality one. I swear it sounds like I'm getting a kickback from him. I'm not getting any kickbacks from him. Okay. Just to make that clear. So that's a really good one that I use all the time. Thorne is another pretty good brand. I think they've got some non-methylated options like hydroxycobalamin. You just really want to, and most people are probably aware, but some people are probably not aware, is that when you have an MTHFR mutation, you don't want to be on the form of cyanocobalamin. Like that should never, ever cross your lips from now until eternity, right? That is, it's almost more of a poison, right? Because your body has to detoxify from the cyanide that the bee is attached to, which takes more nutrients to do, right? And so you're still not getting that methylation support. So just in case someone isn't aware of that, you can check the B12 on the label of whatever supplement you're getting. And if it is ever saying, if it doesn't clarify, toss it, because it's probably cyanocobalamin. Or if it does clarify and it says cyanocobalamin, it's CYANO cobalamin, then toss it. You don't want that one either.
So incredibly helpful. And the nutritionist in me is curious, for people with histamine, I know that a lot of low histamine foods tend to be high in B vitamins. So do people who have histamine problems and the MTHFR, do they always have to be on a supplement, or could they get adequate B12 and B vitamins from food?
So that kind of comes back. So the short answer is yes. If you're eating a good healthy diet with organic grass-fed free-range beef, and you're getting enough for your body, you can get enough through your diet. That being said, there's a whole nother wrench we're going to throw into this conversation now called intrinsic factor. So for whoever doesn't know, intrinsic factor is essentially something that needs to be attached to the B12 so that in the stomach, it happens in the stomach, so that in the small intestine, the B12 can actually be absorbed into our body. And if we have a problem, like there is something called pernicious anemia, where we actually make antibodies that attack the cells that make intrinsic factor, which essentially means that you can take all of the oral B12 you want, and you're still going to be B12 depleted. Like you're not going to ever absorb it. You'll poop it right out. So if that is something that someone's struggling, like they're like, I'm taking a ridiculous amount of B vitamins and my levels don't change, or they change by a very minute amount, this absolutely should be something that is screened for. It's a simple blood test, intrinsic factor, like that's what it's called. And it will let you know if this is a problem. So there are varying degrees of severity when it comes to an autoimmune condition, such as pernicious anemia. And so you might not actually get to the point of anemia, but you can have antibodies against the intrinsic factor. That means that maybe you get 50% of what you should be getting. So you're absorbing 50% of what you should be absorbing. So it's hard to say if you're actually going to be able to absorb everything from your food, but it's also hard to say if you're going to be absorbing everything that you're taking orally anyway. And that doesn't necessarily mean you should be getting B12 shots, like that's necessarily better. It just means that if you're taking a lot of supplements and your numbers aren't really changing, and you're trying to struggle to maintain this, and your doctor hasn't screened you for intrinsic factor, it absolutely has to happen. Like you have to be screened for that. So did I answer your actual question? Okay, perfect.
I'm adding that to my list of things I should probably check if it's on one of the tests I've got. I have a
Yeah,
million of
there you
them,
go.
but
There you go.
wouldn't be surprised.
Yeah.
This is also helpful. We did get a lot of questions about the correlation of cobalt and
Mhm.
B12 and MTHFR. I have no idea what cobalt will what has to do with it, but I'm wondering if you could talk a little bit about that.
Yeah. So cobalt is basically kind of the basis for forming cobalamin, right? It's essentially it's an essential component of B12. And so we humans cannot, well, this is kind of a complicated answer. The quick and easy answer is that for all intents and purposes, we don't make our own B12. We get our B12 from food sources. The food sources we get them from are ruminants, so like our cows that we're eating, right? We get high amounts of B12 from cows and things. The bacteria in their stomachs produce the B12 that we then can eat. Now, yes, some people are like, well, we actually can. Yes, we can produce B12 in our small intestine, but it's missed the intrinsic factor at that point. So we only absorb a very small amount of it. Essentially, it's zero. So I'm not going to get into that debate. But for all intents and purposes, we don't actually make enough B12 to survive. And so cobalamin or cobalt is a mineral that's very, very important for a lot of like metabolism, for the formation of the B12 that happens, in other places, and also how we're able to form some amino acids and neurotransmitters and things like that. But we get a lot of our B12 or a lot of our cobalt from B12. And then we also, can breathe it in and we can absorb it through our skin and things like that. So that tends to not be that big of a problem because we don't tend to see a whole lot of cobalt deficiency. And MTHFR mutation doesn't really have anything to do with cobalt per se. I think the confusion is that because cobalt is the main basis for forming B12, that people with MTHFR should have cobalt. But in reality, we don't make the B12. We have to absorb it. So the cobalt will come along with the B12. So hopefully that's clear. I mean, obviously it is a trace mineral. It is essential for us to survive. We have to have it. But as long as we're replete in our B12, we're usually replete in our cobalt as well. And we're getting it from other food sources and things too. So.
And I know we only have 2 minutes left, so I want to make sure Melissa has all her questions that we can cover answered.
Yeah, I think, I mean, I know you kind of answered it. I figured we should probably just talk a little bit more about folate in the last few minutes. And if kind of staying away from like methylfolate is similar for people with the MTHFR gene. And if you have any suggestions for people with that and histamine issues.
Yeah. So essentially when we have been strictly talking about methylcobalamin B12, but I mean, methylfolate is essentially the same thing, right? It's the other place that we get a ton of folate or a ton of methyl groups from. It is the active, it's the best absorbed, it's the best utilized form. So most of the time, people that have an MTHFR diagnosis, they're actually put on methylfolate as opposed to methyl B12. I guess it just depends on the doctor that you go to. And it also depends on the status of your actual, like, if you have intrinsic factor problems and you have methylation problems, methylfolate is probably going to be a better option for you to take than methyl B12, right? So there are those kinds of considerations, but essentially everything that we've talked about with methyl B12 applies for methylfolate as well for somebody with MTHFR issues and or histamine issues too, like the dosing considerations and that kind of stuff, all applicable.
Awesome. Well, thank you so much for taking more time out of your life to talk about this. I know our audience is going to freak out about this video, and Melissa and I have been nerding out on your content for the last 2 days.
Awesome. Yep. Well, yeah, I apologize that I didn't know that we were going to want to go more in depth. So I am absolutely up for really diving into histamine and MCAS and all of those things too later. So, because you guys probably know me by now, I love talking about all the science nerdy stuff. So I'm all in. It's good.
And I love it because I have all the problems. So this is great. Answering all my questions.
There you go. So you just come up with your questions for me and just shoot them at me and we'll go.
Sounds like a plan. Thank you.
You're welcome.
Thank you so much.
Bye, guys.
Bye.